Most important thing as a patient, you want to make sure that you are aware of the possible signs and symptoms of colon cancer.
Okay.
Some of these include like blood in the stool. If you see blood in your stool, that's something you definitely want to tell your provider about. Pencil thin stools, maybe there's a blockage, abdominal pain, constipation, feelings of fatigue. All of this information is important, and I advise my patients to, when you go see your doctor, take a list with you and write it down so you can give a good report of what's going on.
Let's say that you don't have the symptoms. At what age or at what point should you start being screened for colon cancer, and how do you do it?
Well, basically, the latest recommendations are starting at age 50 through 75. There's a choice of three screening protocols. One is a colonoscopy. Another option, the flexible sigmoidoscope, along with that's every 5 years, along with a fecal occult blood test every 3 years, or for some, just the fecal occult blood test every year, but you have to do three consecutive stool samples sent to a lab.
And that's something you can do at home. It's not the most pleasant thing to have to do, but it is something, it is a method to find this out, and it is very important after age 50, you say.
Well, yes, because that's the time when someone is more likely to have colon cancer, so you want to go ahead and follow those screening guidelines. Now, for those that have a family history or something in their medical history, well, the screening guidelines might start a little earlier. But the bottom line is you want to get those screenings because, as you said when we started out, colon cancer, like most cancers, if it's diagnosed late, the prognosis is most likely going to be a lot worse.
Tell us a little bit about the family history part. Does that mean if someone in your family has had colon cancer specifically, or could it be any form of cancer in your family would put you at higher risk?
Well, really, the guidelines, they focus on a family history of someone with colon cancer at an earlier age. Say, for instance, a brother or a parent that had it in their 40s or even 30s. That's when you are really, wanting to get that person in for the earlier screening.
And this applies to both men and women, right?
That is correct. Colon cancer is actually the second cause of death from cancer in the United States.
Really? And we all remember when Katie Couric famously had her colonoscopy done for all the nation to sort of witness what she went through. Is that something that you said it's recommended how often?
Well, the screening for colonoscopy, it's every 10 years, but for the sigmoidoscope, it's every 5 years, and for the fecal occult blood testing, it's every year.
So several options. Bottom line is to be aware of your health and to get these screenings done. Dr. Timothy Quinn, thank you so much for being on with us.
Hey, thank you for having me.